Welcome to the all viewers and well wishers of the bird. The purpose of my lecture is learn the knowledge from the bird, return the knowledge to the bird. Motto of my life is learn, earn, and return. As I have learned a lot, earned a lot, now it's the time to return a lot to the world. Topic of today is mumps. Introduction of the mumps is mumps, other name is epidemic parotitis. It's a viral disease caused by the mumps virus, characterized by the non-suppurative enlargement of one or both parotid gland, means the no pus is coming from that, so that is non-suppurative. It is an RNA virus which causes this problem, and it belongs to family Paramyxoviridae. Humans are the only natural host of the mumps virus. The virus is transmitted by the respiratory secretion, such as the droplets and the saliva, or via the direct contact with an infected person. Usual onset is 7 to 25 days after the exposure to the virus, and duration usually lasts less than 2 weeks. Frequency most common in the childhood and in the countries that do not vaccinate, so it can occur in the adult age also. So here the characteristic of the mumps is the large parotid gland of the both sides. It is usually bilateral. The other gland involvement one-sided could be because of the bacterial parotitis. So here again one can see the child with the swollen salivary glands due to the mumps virus, and this is one can appreciate usually the both side. But here one can see only the one side is involved more, and here the two sides are involved. Now, risk factors are exposure to someone who's already having the mumps, and the complications are usually the deafness, inflammatory conditions like pancreatitis, meningitis, orchitis, oophoritis, which is causing the reduced fertility and sometimes the sterility also. Diagnostic methods are antibody testing, viral culture, and reverse transcription polymerase chain reaction, that is called PCR, and prevention is by the vaccination. Treatment is usually no cure, but supportive treatment is there, and medications are like the pain medication or intravenous immunoglobulin to just nullify the virus. Prognosis usually excellent. Case fatality rate is 1.6 to 3.8 per 10,000 people. So here one can see the area of the pain which the patient complained, and also the swelling. There, the swellings of both sides mostly is the hallmark of this mumps. Again, one can see the swollen parotid gland. One should know where the location of the parotid gland is. It is here, the gland, and that is swollen. And again, one can see the parotid gland, that it is the normal in size, and here the parotid gland is swollen, and that is the landmark of mumps. The other side is not swollen, so one can compare the normal size of the parotid gland with the enlarged parotid gland, and here also the swollen parotid gland, which gives the appearance like this. And just to know the salivary glands, so here is the parotid gland which have a duct which opens here on the upper molar teeth here, and here is the sublingual gland. As the name is, it lies below the tongue, so the name is sublingual, and the other is submandibular gland because it lies behind the mandible, so that is mandible. Again, here the diagrammatic one can see the parotid gland, which is most of the time involved. The other gland can also be involved, but mostly it is the parotid gland which is notorious to be involved by that. And here there is the sublingual gland and submandibular gland, which are sometimes also involved if the parotid is involved first. Now, the history of the mumps is in Chinese literature, mumps was recorded as back as 640 BC, and the Greek physician Hippocrates documented in 410 BC in first book of epidemics in Corpus Hippocraticum written by him, and the disease in the modern age was first described in 1790 by the British physician Robert Hamilton, and in 1934 etiology of the disease mumps virus was discovered by the Claude D. Johnson and the Ernest William Goodpasture, and Habel in 1945 cultivated the virus in the embryonic egg in the laboratory. Henley and Dean Hart grew it in the tissue culture, so isolating the virus. And in 1948, an inactivated vaccine using the killed virus has been invented. This vaccine was replaced in 1970 with the vaccine live but weakened viruses, more effective at to produce long-term immunity. In 1967, which Maurice Hillman used the Gerald Lynn strain to create this vaccine, strain taken from his 5-year-old daughter Gerald Lynn, so the name has been given the Gerald Lynn strain. And just think how dare they physicians were at their time. They have just taken the virus from their daughter and done these experiments. Mumps historically has been a highly prevalent disease, commonly occurring in outbreaks in the densely crowded spaces like schools and the barracks. And here one can see the great man, the Morris Hillman, heroes of the progress. And here is the Gerald Lynn, the daughter of the Morris Hillman, on which he has taken the sample and named Gerald Lynn strain. Now, etymology, the word mumps is first seen in 1600, is plural form of mump, meaning grimace, verb mean to mutter like a beggar. Disease was called mumps because of swelling caused by the mumps parotitis, reflecting its impact on the facial expression, and painful, difficult swallowing it causes because of the swelling of parotid gland, which is lying just over the mandible. Mumps is sometimes called epidemic parotitis, that is the other name I have already told you. And the epidemiology of the mumps is found worldwide. In absence of the vaccination, 0.1% to 1% of the total population is infected each year. Incidence is higher in children 5 to 9 years old. Symptoms and the complications are more common in males and more severe in adolescents and the adult males. Infection is most common in winter and spring in the temperate climates, but occur in any season in the tropical region, which is more affected than the climate regions. Worldwide, mumps is the most common cause of inflammation of salivary glands. Also, most common cause of the deafness in 1 year is because of mumps. Now, one generation is becoming so busy trying to prove that women can do what men can do, that women are losing their uniqueness. But women were not created to do everything a man can do. Women were created to do everything a man cannot do. This was just because being a woman have the privilege of doing that thing which the men are not able to do yet. So every man on the earth and every woman on the earth is because of the woman. Now, re-emergence. There has been a resurgence in number of cases of the mumps in many countries. The cause include the waning vaccine immunity and the opposition to the vaccination. People are not going for the vaccination in certain areas. Also, low vaccination rates and the vaccine failure is also the reason for re-emergence, and potential antigenic variation of the mumps virus are also responsible for all these re-emergence. Now, the cause of the mumps disease is mumps virus. Scientific name is mumps orthorubella virus in Paramyxoviridae family. Humans are the only natural host, I have told you already. MUV, the mumps virus genome is made of RNA and contains 7 genes that encode the 9 proteins in the mumps virus. In mumps virus particles, genome is encased by a helical capsid. The capsid is surrounded by a viral envelope with spikes protruding from its surface. The virus have both hemagglutinin and neuraminidase represented as HN and, and a fusion protein represented as F protein. Envelope also contain a matrix or the M protein. So here one can see the Paramyxoviridae mumps virus, HN protein, and that is matrix protein, that is the fusion protein, and that is single-stranded negative RNA, and here is polymerase enzyme, and that is the nucleocapsid, the part which contains the nuclear material. And here again one can see the envelope, the H protein, which is said to be hemagglutinin, F protein, F fusion protein, M matrix protein, and here lipid membrane, and there is the lipid membrane nucleocapsid which is covering the genetic material, and there is the nucleoprotein, phosphoprotein, and the large protein, which are all the part of the genetic material of the virus. And here it is the RNA virus which is containing all these genetic and other proteins. Now the cause continuing, the mumps virus particles are pleomorphic in shape and range from 100 to 600 nanometer in diameter. There are 12 genotypes of mumps virus which are recognized, named genotypes A to N, except missing the E and M. So these genotypes vary in frequency from region to region, and mumps virus has just one serotype, so the antibodies to one genotype are functional against all the genotypes, and mumps virus is a relatively stable virus and not much antigenic shifting has been seen in this virus. Now, the transmission of the virus, mumps is highly contagious and spreads easily in the densely populated setting like the crowded population areas. Transmission occurs from 1 week before onset of the symptom to the 8 days later, mainly transmitted by the inhalation or the oral contact with the respiratory droplets or the secretion. The fomites contaminated with saliva and the urine are also responsible for spreading the disease. Respiratory transmission, in cases of the respiratory illness without parotitis, asymptomatic carrier have been seen, and a single case can cause up to the 12 new one called basic reproduction number. So one can infect up to the 12 people, those who have not been vaccinated, and they can have the infection from the one infected people to the 12 non-vaccinated people. Reinfection can occur after a natural infection or the vaccination, means lifelong immunity is not there after the infection or the vaccination. So here one can see the droplet infection, that the person who is sneezing and coughing, putting all these droplets in the environment, and someone else who is just breathing in this environment can have the mumps virus. So the other way of transmission mumps infection is coughing, sneezing, talking. All these lead to droplet infection, and sometimes sharing the drinks or eating utensils with others that do have sometimes the lying of the virus on the utensils, and touching the objects with the unwashed hands that are also touched by the other. So these are the fomites which are also responsible for transmission of mumps infection. Vaccinated individuals who are infected are less contagious than unvaccinated people. Mumps virus is excreted in saliva after the onset of the symptom, peak at the onset of the parotitis. So the saliva is very infective. It is seen in the saliva of the asymptomatic individual also. Mother to child transmission has been seen. Placental transmission has been observed in animals also. And mumps virus has also been isolated from the newborn whose mother was infected with the mumps infection, and mumps virus has been detected in the breast milk also. Now, what is the lifestyle of the virus? What it do in the host cell? The replication cycle of the mumps virus begins when spikes on its surface bond to a cell. Now, mumps virus envelop fuse with the host cell's membrane, the host cell membrane. It releases the capsid into the host cell's cytoplasm. Here, the viral RNA dependent RNA polymerase RP transcribes messenger RNA from the genome. It is then translated by the host cell's ribosome to synthesize the viral proteins. And here one can see very clearly the spikes of the virus that do combine with the cytoplasmic membrane of the host, and now it just injects and fuses with the fuel protein into the cytoplasm of the host cell, and this genetic material causes the replication, and then when it replicates, it is just going to have the transcription, and messenger RNA is produced, which is causing the translation to produce the more proteins and the messenger RNA. And here one can see the replication occurs, and this is going to make the new virions that which is being assembled here, and these are when assembled by the budding process, it comes out the new virion in the mump virus, which is capable of infecting the new host cell like this. So the virus entering, replicating, and just causing the transcription and translation, and that lead to the more protein formation, and that is just the nucleus and the other part of the host cell make the new virions, and here there is the assembly and the nuclear material and the other part. They take the cytoplasm of the host cell to come out as the new virus as the process of budding. So RNA-dependent RNA polymerase then begins replicating the viral genome to produce the progeny. New virions are formed at the sites beneath the spikes, and then they take the envelope by making the cytoplasmic membrane of the host. Mumps virus utilizes host cell protein to leave host cell by budding from its surface using the host cell membrane as the viral envelope, as I have already told you. So here there is very clear picture of that. The fusion and the entry of the virus, as one can see, the virus infectious just coming, infusing, and then it is going to use the enzyme and causing the reverse transcription, and this reverse transcription causes the integration of the viral genome with the host cell genome, which just transcribe and causes the transcription, and then it causes the translation, and it is just going to make the viral genomic DNA, RNA. So all these things, transcription and integration and the translation, just make the new genome and the new virus particles. And these are here, there is the assembly of this new virion, and then these viruses, the new virus, come out by the budding, taking the nuclear membrane or the cytoplasmic membrane of the host cell, and then they become mature, and now they are capable of causing the infection to the new host cell like this, and entering and making the just fusion integration and resulting into the new virus form. Now, what is the pathogenesis of the mumps virus? Virus infects epithelial cell in upper respiratory tract. The HN proteins of the virus attaches to the salicylic acid receptor on the host cell surface. Virus spread to the parotid glands, replicates here, and ultimately spread to the regional lymph nodes, particularly T cells containing causing viruses in the blood, which is called the primary viremia. Now the virus spreads to the spleen and the distant lymphoid tissue. Now it causes secondary viremia by replicating there in those distant lymphoid tissue, and the virus spread to throughout the body via the viremia when they get entered into the body. Testes, ovary, pancreas, thyroid, and the salivary glands are involved by the secondary viremia, and this viremia lasts for 7 to 10 days. So here one can see the silent entry into the respiratory tract when it spread to the local lymph nodes, regional lymph nodes, and here there is a replication of these virus leading to the primary viremia, and now these spread through the primary viremia to the salivary glands, testes, ovaries, pancreas, and central nervous system, and the distant lymphoid tissue, and there it occurs the replication of the virus again, very rapid replication, that to the leading to the secondary viremia. Here there was the primary viremia. Now in the secondary viremia, the generalized spread to the salivary and the other glands of the body, and to the other body sites, including the kidneys. And again, there is viremia and spreading of the virus through the blood to her. And it just in the primary viremia takes the first 5 days, and then secondary viremia in 10 to 15 days, and the generalized edemia and the lethal region are just going to have the 20 days. Here there is again simple way of telling the pathogenesis. Virus enters respiratory tract, and virus goes into the salivary gland and the local lymphoid tissue. That occurs in first 7 to 10 days. Now the virus spread to the spleen and the distant lymphoid tissue, and that causes the secondary viremia. Here is the primary viremia and the secondary viremia. That takes about 15 days. As one can see, it goes to the regional lymph node, spleen, and the other lymph node of the body. Now the virus spreads throughout the body to the testes, ovary, pancreas, salivary, thyroid gland, and the salivary gland. That takes about 18 days, and later about 20 days to reach to these all tissues. Now, in mumps orchitis, Infection causes the parenchymal edema and the congestion of the testes. There is increase in intratesticular pressure causing the necrosis of the seminiferous tubules. Now there is degeneration causing fibrosis and the atrophy of the testes. Mumps virus infiltrates central nervous system causing the meningitis, encephalitis, or hydrocephalus. Mumps is rarely fatal. Deafness is caused by the mump virus infection in CSF, which contact with the perilimb of the inner ear, causing the infection of the cochlea. So here one can see the orchitis. It could be bacterial or it could be the viral. We are just dealing the viral orchitis, which is the mumps orchitis, and here one can see the normal testes, and here the virus with bacterial or the viral infection. There is swelling, there is the nausea and vomiting associated with that. There is very much pain there in the testes, and ultimately there is fever also, which all tells the viral or the mump orchitis. And here one can see the different parts of the testes, the epididymis and the testes and the scrotum, which is all involved in the orchitis.